As physicians and hospitals increase their focus on palliative care, some still carry a negative association of the practice. That's according to Dr. Patricia O'Malley, Director of Pediatric Palliative Care Services at Massachusetts General Hospital. At the 2013 Advanced Pediatric Emergency Medicine Assembly, Dr. O'Malley said developing palliative care in the emergency department is critical, and emergency physicians should use a focused approach when initiating these difficult conversations.
I think if we would focus our questions not so much on a menu-driven approach, would you like dopamine or would you like dobutamine, but rather on a goals and values approach so that we can understand what's most important to families and then use our medical knowledge and our medical technology to help support their goals. So we might ask questions about what they understand about what will likely happen in the future to their child. We might ask how they make decisions, what they use to guide them, what their philosophy of care for their child might be. We could ask them about trade-offs. Are there things that they feel it's not right to put their child through, even if it does gain them more time? We can ask them about function. Would you want to see your child alive if the only way to do that was on a ventilator or with a trach? And these are questions that we can explore with them, not necessarily even with the idea of their having an answer at that moment, but to help them start thinking about those sorts of decisions. As ED clinicians, we're oftentimes in the position of worrying about the bad side effects of opiates. Are we creating addicts? Are we offering the opportunity for drug diversion? But in end-of-life pain, those are not important concerns. The important concern is understanding how we can best respond quickly to the pain, and to understand the pain in the context of that child's life, what the pain means, because pain at end of life has a particular significance. Both children and families will understand it as likely meaning that they are closer to their death. And making that explicit, or at least letting that inform our actions towards the child and family is important. Yeah. And while there are a lot of things weighing against us in the emergency department that make it a less than ideal location, the noise, the census, the bed shuffling, all that, I think because we have an opportunity that doesn't always present itself. We have an acute change in health status. That's an opportunity for us also to open that discussion and that conversation with people.
From Orlando, Florida, I'm Frances Correa.